goes. Alrighty, so welcome back. So tonight I've got part two for just some more general information about breast cancer itself, and I am going to be leading a little bit more on Dr. Barnard's nutritionmd.org and an article from the Up to Date website as well, which you'll find in the comment section after the presentation. So again, breast cancer is very, very common in women in America, about 1 in 8 over the course of a lifetime. And at one point it was also the second most common cause of cancer death in women, and it was one of the most common cancers in women in general. Sometimes these numbers of which one's more common, they kind of fight with each other for a little bit, and then one wins out more than the other 1 year, and then the other goes back and forth a little bit. So the development of breast cancer is associated with increased levels of estrogens and estrogen-like compounds, which are basically female sex hormones. And so if you've got a lot of them in the body, then these cancers which are responsive to these hormones tend to be more common and more aggressive. And one of the things that was kind of found out more recently was the risk of uninterrupted hormone replacement therapy and such, and early starting of periods or the late onset of menopause. Why? Because if you start your period at age 9 or 10, which is increasingly common in our society right now because of a lot of these hormone-rich foods that are being taken, and people don't realize that the cows that we're milking these days basically are, I hate to use designed, but they're selectively bred so that they have milk throughout their pregnancy. Even when they're pregnant with the next calf, they're still producing milk, and so the amount of hormones, anybody who's been pregnant knows there's a lot of pregnancy hormones flowing through the body, and the rates of the hormones that are being transmitted into the dairy product much, much higher than they used to be in 20, 30, 50 years ago, that sort of thing. Anyway, so the women in this country are tending to get their periods earlier and earlier, even as young as age 8 and 7 in some cases. I've seen young girls that have had to be on shots in order to stop that puberty process. Again, why do you want to stop the puberty process when it's starting in a 7-year-old, besides the obvious stuff? But one of the side effects of that, if the puberty starts too soon, is you end up with shorter women, the bones fuse earlier, and also the total lifetime exposure to those estrogens is higher over the course of a lifetime. And so food choices, accumulation of body fat also affects the amount of estrogen in the bloodstream. And so what are some of the symptoms of breast cancer, things you should watch out for? So the most classic is the breast lump, which is why a lot of these breast cancer prevention websites will have different methods of teaching how to do a breast exam. I usually teach the ladies who are doing the self-breast exam, try to check at the same time every month. The skin is more sensitive to the touch with the fingers, and in general during some time is like the shower, because it's wet and stuff and you're naked anyway. And if you do it after your period, the breasts are always the lumpiest around that time, and so you get a sense for what it should feel like at the same time. And although not everything can be found by just touch, there are a number of breast cancers that women do pick up on their self-exams as well. So the formal physical exam, the recommendations kind of go back and forth on how useful is that in the long term, for a doctor to perform it on the woman. Again, something to discuss with your primary care physician or whoever, your gynecologist who is taking care of you. How accurate is this test? And I'll tell you, if I remember your breasts from the previous time, my memory is not that good to be able to say, oh, there was a change this year versus last year. And maybe other doctors have better memories with regards to that, but breast to breast, yeah. See when you see mom, in a sense. Anyway, so there can be lump, thickening, dimpling, redness of the skin. Sometimes we talk about something called peau d'orange, basically orange peel like skin that like the follicles, little bumbles or dimples that are on the skin, they kind of get pronounced, and the skin scrunches up, and it very much looks like an orange peel. So if you got any of that going on, please go get checked out. A breast pain and tenderness, not necessarily associated with cancer, although occasionally it can be part of an inflammatory breast condition. And so a lot of times that involves infections and other things. So again, if something's sore, get checked out. The most common cause of breast tenderness is actually fluctuating with the hormone cycles, a week before the period, or if someone becomes pregnant, again, the breasts tend to get much more sensitive or sore during those times. And sometimes the only thing that's noticed is funny looking spots on a mammogram. And so the changes to the American guidelines for when and who to screen, we'll get into that a little bit later, but generally speaking, for most women, the American Preventive Task Force recommends starting at age 50 and doing it every other year. The American Cancer Society guidelines, however, still suggest at age 40, and so a lot of us end up having individualized discussions to figure out where are you with your individual cancer risk. And there's actually, we can plug in some numbers into a guideline to kind of calculate what the risk is for that, and so help choose some of these dates and times. But those are, again, good things to learn about so you can have a good discussion, an informed discussion with your primary care as well. Men do also get breast cancer as well, although it is much more rare, and unfortunately, because the men are not necessarily as attuned to double checking in these areas, oftentimes if it does turn out in a guy, it tends to be a little bit more aggressive and found at a later stage, and so forth. But fortunately, it's only about 1% in the guys compared to the women. So right now, it might even be higher odds than this article from Dr. Barnard's. He was saying it at 85% 5-year survival rate for breast cancer in general. Basically, what that means is that after 5 years, if a woman's diagnosed with breast cancer, there's about an 85% chance that she'll still be alive. In my previous talk tonight, talked about some of the different kinds of things that a woman can potentially do to just hedge her bets, and either with specific foods help prevent the cancer or also prolong survival. You just using the best of the science we know right now, some of these things can be influenced. So some of the risk factors for breast cancer. So age, the older a woman is, the more likely she is to potentially get it as well. I'm going to switch over to the up-to-date article to go for with you. But basically, the primary risk for breast cancer in most women is just surviving to older age. So the incidence goes sharply up with age until about age 45 to 50, at which point it doesn't increase quite as quickly. So basically, most of the breast cancers are found after age 45 to 50. And then at age 75 to 80, the new onset breast cancers are not quite found as often, and then they start to kind of go down. So in other words, if you've got good enough genes and lifestyle and other habits to make it to age 95, the likelihood of all of a sudden developing a breast cancer at that late age is lower, because presumably other factors have kept you from getting these things earlier in life. Anyway, so again, breast cancer occurs about 100 times more often in women than in men. And this is where one of my articles contradicts Nutrition MD, so I'm thinking this one's probably more up to date than the other one. So sometimes what the researchers like to do is like to take a disease and they break it down by what ethnicity appearing groups tend to get things more often. of course, women of every race and nationality are vulnerable to such common things as breast cancer. So Dr. Barnard had something saying that the African American women in his thing basically had a higher incidence, whereas the up-to-date article is saying that the rate of cancer was lower in the African American or Black women. And so, again, doesn't really matter, whether there's 124 cases diagnosed for every 100,000 or whether the rate is 113 per 100,000. I mean, basically, it is what it is, So apparently, if you follow that line all the way through, the women who happen to be American Indians or Alaskan natives, the rate was 92 per 100,000 per the updated article. The Hispanic women was 90 per 100,000, and the lowest rates were in Asian Americans and Pacific Islanders at 82 per 100,000. And whether that has to do with the types of foods that are consumed, because as we talked about in the last presentation, the cultures where soy foods, for example, are prevalently eaten, the rates of breast cancer later on in life are actually a little bit lower. And so some of these things are some of the things that have fueled the search for, if this category of women is having 124 cases per 100,000 and this other category of women is having 82 cases per 100,000, well, are the folks in this lower category doing something right? And it turns out that the higher the incidence of eating soy products, especially before the puberty years, it was linked with lower incidences of breast cancer. So maybe it's not all genetic, but maybe some cultural lifestyle things that kind of creep in may play a role as well. So weight as risk factor. So again, weight and obesity are associated with an increased risk of postmenopausal breast cancer. Strangely, a higher risk or a higher BMI or higher weight before menopause hit was associated with lower risk of the cancer before menopause, on one of these studies, but they're saying, well, we don't really understand why that might be. But having greater adipose tissue or fat cells, basically, in general, was definitely associated with increased risk of getting breast cancer after the ovary shut down. And since most breast cancer happens anyway after the ovaries are shutting down, like in the age 50s and 45 onwards, I think that's a little bit more of a consideration. So here's one that kind of surprised me. So I guess I'm glad to be short in a sense, but the taller a woman was, the higher the risk for breast cancer. So the women who are at least 69 inches tall were a little bit more likely to develop breast cancer compared to the women who are less than 63 inches tall. So I guess nothing that women can do particularly about that thing other than if you happen to be tall, I guess. Maybe just take it in consideration and, try not to drink or smoke, that sort of thing. Take some of this information and do with it what you can. So the idea is things you can modify that you're in control of. So can you control how tall you are? Not really. So we'll just let that one sit there. Increased estrogen exposure, mentioned again last presentation. So the more actual animal-like estrogens you get in the body, the more trouble it causes over the time. So, of course, there's also other kinds of benign breast diseases. So basically, if, kind of like with a lot of other types of cancer things, if people are developing polyps and then funnier looking polyps and then even funnier looking polyps for the case of colon cancer, similarly, if women are getting like these weird changes to the breast, that's not quite cancer, but it's not really normal. Like atypical hyperplasia and other similar kinds of things are a little bit more at risk as well. The women that have many denser areas of tissue on their mammogram are a little bit higher risk for cancer versus the women that it's mostly basically fatty tissue. And I think part of that also has to do with how easy is it for the radiologist to be able to like peer through, theoretically speaking, with these x-rays, the tissue, and be able to distinguish, all right, this is normal versus this is really not normal. And when a woman is younger, the breast tissue tends to just be very dense in general, which is why we use ultrasounds and sometimes MRIs to get a better sense in these cases. And then after age 45 or so, it's mostly replaced by fatty tissue. So higher bone density basically just reflects higher circulating estrogen. So the women that have the higher bone density may be a little higher risk of breast cancer because basically the bone also contains some of these receptors. So incidentally, if someone's got a breast cancer, one of the places where that cancer likes to live is things like the lungs, the brain, the bones, and so forth, and maybe because they came from similar places in the early development. Personal history of breast cancer. So if a woman has a prior history of cancer in one breast, there is definitely a higher risk of developing cancer in the other breast. It's not an absolute, like, if you got it once, then you got to keep an eye out the other side. And so, for example, if a woman had a higher history of ductal carcinoma in situ, DCIS, basically the risk of getting it is about 5% over the next 10 years, roughly. But if a woman has had a personal history of a invasive breast cancer, the risk is about 1% per year before menopause, and after menopause about 0.5% per year. So basically it's just one more risk factor. So if someone's already had breast cancer, you gotta kind of keep an eye out for things as well. Family history. So again, it's not exactly so you can choose your family, but sometimes people will go to some of these online ancestry and other DNA reporting resources, and even if they don't know if they had a family history like adopted or something, then may be able to get a little insight from the genes. It's a whole up and coming area to look into. And at some point, I'm sure we'll have personalized genomic medicine for everybody one of these days. Not quite there yet, but anyway, so if you've got a first-degree relative of breast cancer, whether it's mom, sister, daughter, that's first-degree relatives, basically the lifetime risk of developing breast cancer in the relatives is higher. However, it is very important to note that most breast cancers are essentially out of nowhere, it seems like. So nobody else in the family has any breast cancer in most of the cases of it. So although if you got a relative that's got it, you got to keep an extra eye out. But even with the women, they're like, oh, phew, I've got nobody in my family with breast cancer. Watch out, you're actually in the majority of the women that suddenly get it. So only a family history is reported by only about 20% of the women that have it for breast cancer. And then less than 10% of the breast cancers that we know of are associated with specific gene mutations. And so, again, people get worried about things like the BRCA1, BRCA2. That tends to be the most common groups of genes that get knocked out they're associated with the breast cancers. And so for women with a BRCA1 or BRCA2, the lifetime risk of cancer is anywhere between 40 to 70%. And so there's some very famous actresses and such that got the testing done and then chose to basically remove the risk to a considerable degree by removing the breast tissue. And so that's a little bit beyond the scope of this quick little doc talk tonight, but just beware that that fear of developing breast cancer is very high, and many women that do the testing then are seemingly faced with a choice, like, wait, I've got these genes, they might be associated with it, what do I do? And in order to relieve that anxiety, sometimes women will cut off the body part as well. So that, of course, is a very, very intensely personal decision and worth a little bit of research before going that far as well. So I encourage discussion and learning about the risks and benefits of that as well. All right, so menopausal hormonal therapy. So women that have used combination of estrogen and progestin, for 5 or more years, in the realm of ages 50 to 79, that combined estrogen progestin does raise the risk of breast cancer, as well as heart disease, strokes, and clots in the legs, and all sorts of other things. And when the estrogen is used alone, without that extra hormone in it, the risk is maybe not quite as high, especially if you use it for a short amount of time. So we used to go from basically recommending, use the Premarin and other kinds of estrogens to relieve the hot flashes, carte blanche, basically. You got problems, just up the dose, and so on and so forth, and use it for the whole amount of time. And so the pendulum kind of keeps swinging a little bit back and forth, and we used to go from giving it out like candy to, wait a second, maybe we should only give it out for a short amount of time to the fewest people that we can to change the risk of whether someone develops like cancers as a result of it. So again, another thing to talk about. Dr. Greger had some interesting things about oral contraceptives with different things, including the risk for breast cancer. So I encourage you to kind of check that out as well. The up-to-date article is saying, we don't think there's a risk between that and breast cancers in general. So basically, and similar, there's not very much data as far as the fertility medications, which we're giving women a high dose of hormones to stimulate making eggs and using for fertility treatments in general. So higher testosterone levels, so we find that in women with PCOS, so please check out my PCOS video as well. And things that can be done to lower the amount of testosterone. There's a neat study on using mint to lower the testosterone levels in women. Again, more details in the PCOS video. But basically, the women that had the higher testosterone levels in general tended to get a little bit more risk of the breast cancer, especially for the breast cancers that are especially receptive to the hormones, hormone receptor positive disease. Insulin. So basically, when women have high levels of insulin, so all this diabetes epidemic, all this insulin resistance, basically when the body is not able to handle the sugars as well, and it's trying to like pump out more and more and more insulin to overcome the body's developed acquired insulin resistance, which can be reversed through diet, whole food, plant-based diet. By the way, please check out my diabetes, pre-diabetes videos as well to learn more about how that happens. But basically, when people have high levels of insulin, it also can trigger things such as the breast cancers as well. So another reason to keep basically the whole body, at normal levels, but also basically the same dietary pattern that tends to be very good for helping to prevent things. Also helps to prevent cancers. So. All right, so there's a chemical, I'm probably not going to do very good with pronouncing this one, but it's called DES is the short version. And those that have seen me in clinic, I oftentimes will during the woman exam say, hey, have you ever been exposed to DES, diethylstilbestrol? Basically, it used to be given to women like before 1971. About several million women in the United States were given this chemical in an attempt to prevent complications from their pregnancies. Little did they know that the daughters of those women that were given that chemical during the pregnancy would end up with higher rates of like vaginal and other kinds of cancers, especially the reproductive system. So basically, it was a little study that showed that those few women that were still alive now that were exposed to that DES chemical are a little bit increased risk of breast cancers in general. So I already talked about the time of when this menses started and the length of duration of having periods over the course of lifetime before menopause. So having a younger age when the periods start and an older age when the periods stop, the women that undergo that longer period are a little bit more likely to develop breast cancer than the women that have, for example, basically given birth multiple times. I mean, Women who have never given birth and have had their whole lives exposure to these hormones continuously, much more likely to develop breast cancers in general than the women who've had multiple children or given birth multiple times, as it were. And then the younger a woman is at her first full-term pregnancy, the lower her risk of breast cancer later. This is not endorsing teenage pregnancy. It's saying that if you tend to be starting the process a little bit earlier in life rather than waiting till you're like say age 8, 38, or 40, again, the benefit is a little bit more. So also breastfeeding. So the women that breastfeed for a little bit longer tend to be a little bit more protected against breast cancers in general. And then going into more lifestyle things that we can control. So another bullet point about physical activity. So exercise appears to protect against breast cancer in both before menopause and after menopause populations. And also tobacco again. So the women that start tobacco earlier and use it for longer and higher pack years of smoking. In other words, the women that are smoking 3 packs a day are at higher risk than ones who smoke 1 pack a day, but any amount of tobacco is too much. So please, if you're still using it, get off of it, or consider getting off of it. But not only just the active smoking, but also that passive smoke inhalation. So the women that are in restaurants and bars and other locations that still allow the use of tobacco and passively inhale these carcinogens are also going to be a little bit higher risk because, of course, inhaling carcinogens, kind of a thing there. So, all right, so dietary factors. So we talked about alcohol, the previous one, even as low as 3 drinks per week. There does not seem to be a lower limit for the alcohol in general from some of the other research that I've seen. But the higher the alcohol consumption, the more the risk for developing breast cancer, especially if you're drinking more than 3 drinks per week and also using that menopausal hormone therapy, seems to be higher risk as well. Some studies with a whole food plant-based diet, they're calling it a diet produced of fruits and vegetables. I mean, forgetting about the whole grains and all that other stuff. So basically, a whole food plant-based diet is protective, lower dietary fat in general can be protective as well because, again, we talked about how that cholesterol, when you're having a high-fat, high-animal-based product, your body is basically having higher levels of cholesterol, which is like giving oil to the fire of the cancer. So I'm trying to keep that away as much. So a higher than 5 servings of red meat specifically per week in one study was associated with an increased risk of that hormone-positive cancer before menopause, so that early cancer. And then there's also something interesting about vitamin D. There's a little bit more research that needs to be done on that. There seems to be a link between low vitamin D states and things like cancer, whether that's because it's a fat-soluble vitamin, so women that, for example, are more obese tend to have lower levels of vitamin D floating around in their bloodstream because presumably it's kind of sequestered away in those fat cells somewhere in the body. Maybe it's also because we're indoors much more than previous generations might have been. But that's an interesting one to look at. There seems to be some link between the low vitamin D, but whether it's a causal link as one causes the other, or whether it's just kind of association that women that are heavier tend to have lower vitamin D levels, and therefore it's kind of similar risks. No evidence for intake of vitamin A, E, C, or beta-carotene on breast cancer risk. Again, they're looking at when people are manufacturing vitamins and like distilling stuff out of the carrots, for example. I mean, why not just eat a carrot and get all the phytonutrients, all that good stuff directly? But sometimes people are like, oh, I don't need a carrot, and I'll have a pill and try to cover my bases that way. And generally speaking, when we prepackage things with like talc and whatever else that they have as binders and fillers in there, then that tends to not work as well. And many studies have shown that out. In fact, if you look at nutritionfacts.org, there's a presentation on the multivitamins increasing the risk for breast and prostate cancer both. And so I used to recommend multivitamin way back in my early days of practice. And then after I saw a few points where this multivitamin and cancer risk was brought out over the years in a couple of different journals, now I've started telling people not to have a multivitamin to get their nutrients directly from the food sources, because Mother Nature doesn't mess it up as much as we do, I guess, is kind of the bottom line on there. So again, antioxidants in the form of food, protective because you're getting all that fiber and all the other micronutrients that go along with it. Antioxidants in the form of what the chemical companies are distilling into pill form, not so much, and may actually be contributory. So the soy phytoestrogens, again, basically that it is protective, and especially found, those isoflavones are found in soybeans and other beans in general, and lignans, which are found in fruits and veggies and other cereal products, as well as very high in those flax seeds as mentioned before. Alrighty, so other environmental factors. So geographic residence. So there are some areas of the country where the risks of certain cancers are higher. I don't know exactly what, like, for example, Flint, Michigan is looking at, but I have talked to some coroners, actually during my stint in Mississippi for 4 years, and he would definitely tell me that, you know, when he was looking at the people that were coming in who had died in these areas, he saw higher rates of cancer in various areas. My suspicion is that there probably is some sort of basic chemical exposure. Like, for example, in Mississippi there was a lot of manufacturing and there was a lot of agriculture, so people were getting exposed to pesticides and all sorts of stuff in various locales, and so there's likely some links with that. So again, things to be keeping an eye out for. If you live next to a Superfund site, you might not want to drink the water, for example, unless you've had it thoroughly tested or something, but again, not things. So ionizing radiation. So basically, if you are a survivor of an atomic bomb or a nuclear plant accident, high risk for breast cancer, because that ionizing radiation damages that DNA and thus is linked to the higher rates of cancers. So why else might a young woman get exposed to some of this ionizing radiation? Well, unfortunately, if she develops a Hodgkin lymphoma and then, or some other cancer at a young age, and has basically radiation treatment, that will definitely raise the risk for cancers. Other things like night shift work. So when I spent my days in the hospital, I knew that night shift was not necessarily my favorite time to be doing work, and you just have this whole thing where you just kind of feel draggy, and you basically, it's a little different than day shift work. But there's actually, the women that are working at night actually have higher rates for things like cancer, along with some other health problems as well. So they are thinking that it might be related to, again, a different hormone, melatonin, which is produced basically in reaction to light levels throughout the day. And so basically when people are having insomnia, sometimes we'll recommend taking melatonin. So this is not a recommendation to take melatonin to prevent breast cancer. What it is just saying, hey, if you're a night shift worker, and if you're able to, maybe consider moving to the daytime if possible, for many health reasons. So then there's also, as mentioned before, with kind of in tangent, basically having seen people reporting back to me that, hey, there's clusters of cancer cases in the country. So they're looking at things like PCBs, dioxins, organochlorines, and other pesticides like DDT, which is still lingering in our environment. And so a lot of these industrial compounds are basically estrogen stimulating, mimicking compounds, and so they seem to be related to the breast cancer risk. And so it's possible that these things, not only do they stick around in your body tissue for years, but may also play a role in turning these genes on. So there's some other things that are a little bit not so much, we don't know for sure. It mentions, maybe, so I'll skip that one. All right, breast cancer risk. So things that you can do to basically reduce the breast cancer risk. If you're planning to get pregnant, trying to plan for that first birth before age 30 is recommended. Try to breastfeed for at least 6 months. Very good for the baby and good for the mama, as it were. And then if you're going to be using hormone therapy during the menopausal years, try to either figure out a way to avoid it, like check out my menopause video, or if you're going to use the hormones, use it just the lowest amount for the short amount of time for that as well. Avoiding tobacco, of course, limiting alcohol, again, maintaining a healthy body weight, trying not to work night shifts as much as feasibly possible for your situation. And then being active. So the recommendations in general to shoot for is at least 150 minutes of moderate intensity activity. So could involve things like walking, going to the gym, gardening. I mean, all sorts of things that can kind of get the heart rate going a little bit. So a lot of times some people will say, yeah, but I walk for work. Okay, that's great, but usually when people are moving around as part of their jobs, they're not necessarily doing it in such a way that they get all sweaty and gross and all that kind of stuff. So the idea is, in addition to what you're already doing, try to do something extra. And if you can, at least 150 minutes of moderate intensity. And then if you're able to make it, about 75 minutes of vigorous intensity would be ideal. But basically anything above your routine baseline is going to be beneficial. So try not to be sitting on your butt all day, so sedentary behavior, or standing in one place all day, but try to find some way of getting up and about and moving around as well. So there's a whole article separately on figuring out whether or not tamoxifen and other chemical components are good for you as far as preventing the risk. And then there's also some tools to use to figure out the risks as well. Alrighty, so I use this to kind of wrap up the section on just general risk factors that modify the risk for developing breast cancer. And of course, some of those things like who are your relatives and who's your mama kind of saying, you can't really do much about that. I mean, how much can you do about your height? I am not condoning cutting your feet off to be shorter. That's not the point of this. But being aware of the risk factors and being aware of those risk factors that are in your hands that you're able to improve or modify can be very helpful in the long run. So a lot of health is not necessarily what you do in the spur of the moment. It's what you do in the spur of the moment to get started, and then keep doing some of these things on a day in, day out basis. And over the course of a lifetime, it can steer your body in one direction, or it can steer the body in an entirely different direction as well. So, alrighty, let's see, anything else for this particular section. See if there's anything else from Dr. Barnard. Again, we talked about different kind of screening things, the importance of whole food, plant-based diet in general, lots of fiber, avoiding the fatty foods, maintaining a healthy body weight, reduced intake of saturated fat and meat, and we talked about that, more fiber, avoiding alcohol. Oh yeah, there's one more little point here from Dr. Barnard's resource. 2 drinks of alcohol per day or 30 grams of alcohol, 40% increased risk of breast cancer compared to the women that did not drink at all. And even 1 drink a day was found to increase the risk by 10%. And then finally, increased intake of foods that are containing folic acid. So foods that are rich in folate. So we talk a lot about how important it is to have dark green leafy vegetables and beans and so forth. Not only does it help prevent potentially birth defects in the children of women that are having these things, but they seem to be also protective against breast cancer as well. So Basically, getting the whole food version rather than trying to find a pill to take is always going to be better in general. So because you're getting the fiber and all the other micronutrients that make those foods especially healthy. So those are your green leafy veggies, your legumes, and oranges as well, very rich in folic acid. Alrighty, so I think that pretty much summarizes everything about breast cancer. Maybe we'll do something else spelling out some of the main screening methods, but we talked about already, individual breast exams, mammograms, ultrasounds, MRIs. There's always new technologies and new markers and new things coming up in the future. So keep an eye out for upcoming developments, and meanwhile, do what you can with what you got and just take it one step at a time. All right, so have a good night. Thank you for joining and watching again, and we'll see you next week. Bye-bye.